Stop believing the most dangerous myth about weakness after 60, that shaking legs, dizziness, a racing heart, and difficulty rising from a chair simply mean your liver has stopped making blood, and that one miracle drink can fix everything in 3 days. That idea sounds comforting, but it can delay the test that actually saves your independence. Here's what research shows. A major review in Seminars in Hematology reported that more than 10% of community-dwelling adults age 65 and older meet the World Health Organization definition of anemia, and the rate rises above 20% after age 85. Even more important, roughly 1/3 of anemia in older adults is linked to iron, folate, or vitamin B12 deficiency, while another large share is connected to kidney disease, inflammation, or other medical problems. The National Institutes of Health also reports that, depending on the definition used, vitamin B12 deficiency may affect about 3 to 43% of community-dwelling older adults. Those numbers matter because the symptoms you feel in your legs may begin with something happening in your blood, your nerves, your kidneys, your gut, or your liver long before you understand the cause. My name is Dr. William Lee, and today I'm going to show you 4 evidence-based pieces of the anemia puzzle, counting down from number 4 to number 1. 2 are foods you asked about, beetroot and kiwi, and 2 are vitamins that become especially important with age, folate and vitamin B12. But stay with me, because number 1 is the nutrient deficiency that can cause anemia and nerve symptoms at the same time, which means trembling, tingling, imbalance, or difficulty walking can sometimes be mistaken for just getting old. All scientific references discussed today are listed in the description. Before we dive in, tell me your age in the comments and answer one personal question. When you stand up from a chair, what bothers you most? Weakness in the thighs, dizziness, shaking, breathlessness, or a pounding heartbeat? I read every comment because the pattern of symptoms often teaches us what seniors are facing in real life. Now let me correct one more myth. In a healthy adult, the liver is not the main factory that makes red blood cells. Think of your bone marrow as the factory floor, your kidneys as the manager sending a hormone signal called erythropoietin, or EPO, and nutrients such as iron, folate, and B12 as essential building materials. The liver is enormously important for storing nutrients, processing proteins, regulating metabolism, handling toxins, and supporting clotting. But adult red blood cell production normally happens in bone marrow. Liver disease can still contribute to anemia through inflammation, poor nutrition, bleeding, enlarged spleen, alcohol-related marrow suppression, or other mechanisms, so the liver absolutely deserves attention. Yet weakness should never be diagnosed by guesswork. The NIH lists tiredness, weakness, shortness of breath, dizziness, fainting, and irregular heartbeat among common anemia symptoms. If you have chest pain, fainting, severe breathlessness, black or bloody stools, new confusion, yellowing of the eyes, or a very fast heartbeat, do not wait for a food remedy. Seek urgent medical care. Anemia is not one disease. It is a warning light, and the correct treatment depends on why that light turned on. Number 4 is beetroot, and here is the dramatic truth. Beetroot may support circulation, but it is not a blood transfusion in a vegetable. Beetroot is actually a root vegetable, not a fruit, and its most studied cardiovascular ingredient is dietary nitrate. Your body can convert nitrate into nitric oxide, a signaling molecule that helps blood vessels relax. This matters in older bodies because nitric oxide availability often falls with vascular aging, oxidative stress, inflammation, and reduced endothelial function. In simple language, the inner lining of your blood vessels becomes less responsive, like an old garden hose that does not expand as easily as it once did. A randomized crossover study from Massey University involving adults ages 50 to 70 found that 150 milliliters of nitrate-rich beetroot juice increased plasma nitrate and nitrite and reduced blood pressure, with a larger reduction in diastolic pressure in the older group. Another randomized study in healthy older adults found short-term reductions in blood pressure 3 hours after nitrate-rich beetroot juice. But newer research is mixed. A 2024 randomized placebo-controlled crossover trial from the University of Vienna in adults ages 56 to 71 with treated hypertension found that nitrate levels increased, yet 4 weeks of beetroot nitrate did not produce sustained improvements in blood pressure or forearm blood flow. That is exactly why I will not tell you beetroot cures anemia. It may support vascular biology, but it does not replace iron, B12, folate, diagnosis, or treatment of blood loss. Why can that still matter after 60? Because anemia reduces oxygen delivery, while sarcopenia, the age-related loss of muscle, reduces your physical reserve. Anabolic resistance means older muscle does not respond to protein and exercise as strongly as younger muscle. Mitochondria, the tiny energy engines inside your cells, also become less efficient with age and chronic disease. If oxygen delivery is poor and muscle reserve is already lower, standing from a chair can feel like asking a small battery to start a large engine. Beetroot cannot create new red blood cells overnight, but a nitrate-rich vegetable pattern may support circulation as part of a larger plan. A practical food portion is about half a cup to 1 cup of cooked beetroot with a meal, rather than assuming a concentrated juice is automatically better. If you use blood pressure medicine, have a history of kidney stones, have kidney disease requiring potassium restriction, or regularly feel lightheaded when standing, ask your clinician before using concentrated beetroot juice. The synergy tip is more important than the beetroot itself. Pair beetroot with a balanced meal containing a real protein source and an iron source, and add a vitamin C-rich food to improve absorption of plant-based iron. And that takes us directly to number 3, because the next food can make iron from a meal easier for your body to absorb. If this is helping you separate viral claims from useful science, tap like and subscribe now, because the next 2 items are where older adults can make costly mistakes. Some people take folic acid without checking B12, while others swallow iron for months, even though their anemia is caused by kidney disease, inflammation, bleeding, or B12 deficiency. Sharing this video with one person over 60 may help them ask for the right blood tests instead of guessing. Number 3 is kiwi, and this small fruit has a bigger role than most people realize, not because it makes blood by itself, but because it can help the body absorb non-heme iron from plant foods. Kiwi is rich in vitamin C, also called ascorbic acid. Vitamin C changes iron into a form that is easier to absorb in the intestine and helps keep that iron soluble during digestion. A randomized controlled trial published in the British Journal of Nutrition studied women with low iron stores who ate an iron-fortified breakfast cereal with either 2 gold kiwi fruit or a banana every day for 16 weeks. The kiwi fruit group had a significantly larger increase in serum ferritin, the body's iron storage marker. Median ferritin rose by 10 micrograms per liter in the kiwi fruit group, compared with about 1 microgram per liter in the banana group. That does not prove the same exact result in a 75-year-old man, and it certainly does not prove a 3-day cure, but it demonstrates the principle. Vitamin C-rich food can improve the usefulness of iron in the meal you are already eating. For an aging body, this matters because stomach acid may decline, appetite may shrink, medications can interfere with nutrients, and chronic inflammation can trap iron in storage so it is less available for new red blood cells. When oxygen delivery falls, mitochondria in your leg muscles cannot perform at their best, and existing sarcopenia becomes more noticeable. The result may be slow walking, fatigue on stairs, or needing both arms to push yourself out of a chair. A practical approach is 1 or 2 whole kiwi fruit eaten with an iron-containing meal, not on an empty stomach as a medicine. For example, have kiwi alongside iron-fortified cereal, lentils, beans, tofu, eggs, fish, poultry, or meat according to your dietary needs. If plant foods are your main iron source, the vitamin C pairing becomes especially useful. Avoid tea or coffee right with an iron-rich meal if you are trying to maximize non-heme iron absorption, because compounds in those drinks can reduce absorption. If you have a kiwi allergy or have been told to restrict potassium because of advanced kidney disease, follow your clinician's advice. The synergy tip is simple. Kiwi plus a genuine iron source is more logical than kiwi alone. And now we move to number 2, the vitamin your bone marrow needs whenever cells are dividing rapidly to create new blood. Number 2 is folate, also called vitamin B9, and this is where the biology becomes powerful. Red blood cell precursors inside your bone marrow divide rapidly. Folate is required to make DNA, the instruction manual every new cell must copy. If folate is severely deficient, those developing blood cells cannot mature normally, and a type of large cell anemia called megaloblastic anemia can appear. The NIH Office of Dietary Supplements recommends 400 micrograms dietary folate equivalents per day for most adults. Folate is found in leafy greens, beans, peas, oranges, avocado, and fortified grains. Yet here's the part many quick fix videos leave out. More is not always better, especially after 60. The NIH notes that some older adults already exceed the tolerable upper intake level of 1,000 micrograms per day of folic acid from supplements and fortified foods. High folic acid intake can correct the anemia of B12 deficiency while allowing neurological injury from B12 deficiency to continue unnoticed. That is why a bottle of folic acid should not become your first response to shaking, tingling, or balance problems. Aging makes this issue more complicated because chronic inflammation can change nutrient handling, digestive disorders can reduce absorption, alcohol can impair folate status, and medications may interfere with folate metabolism. At the same time, sarcopenia reduces strength, so even mild anemia can feel more disabling. Imagine your muscles as a construction crew that already lost several workers with age. If the oxygen delivery trucks arrive half empty, every task becomes slower. Folate only helps if folate availability is actually part of the problem. It does not fix internal bleeding, kidney disease, cancer, thyroid disease, or advanced liver disease. Your practical preparation should begin with food. Include a folate-rich food at least once or twice daily, such as cooked lentils, beans, spinach, asparagus, or fortified whole grains, adjusted for your medical conditions. The adult target is roughly 400 micrograms dietary folate equivalents from food and appropriate supplements combined, but treatment of proven deficiency should be directed by a clinician. Do not take high-dose folic acid on your own before B12 status is considered. The synergy tip is crucial. Folate and B12 work as partners in DNA and red blood cell formation, so assessing both is safer than focusing on one. And that leads to number one, the deficiency seniors most often miss because the problem may be absorption rather than diet. Number one is vitamin B12, and for adults over 60, this can be the most surprising piece of the puzzle because B12 deficiency can affect both blood and nerves. The NIH reports that anywhere from about 3% to 43% of community-dwelling older adults may have B12 deficiency, depending on the cutoff and population studied. Why such a wide range? Because deficiency can be difficult to define, and because older adults are more likely to develop atrophic gastritis, a thinning and inflammation of the stomach lining that reduces the acid needed to release food-bound B12. Pernicious anemia, an autoimmune condition that blocks normal B12 absorption, is another important cause. When B12 is low, red blood cells may not form properly in bone marrow. At the same time, nerves can suffer. NIH guidance lists tingling, trouble walking, uncontrollable movements, confusion, memory changes, and other neurological symptoms among possible features of B12 deficiency anemia. That is why trembling hands, unsteady legs, numb feet, and difficulty getting out of a chair should never automatically be blamed on the liver. Research in older adults shows why testing and proper treatment matter. A dose-finding trial in 120 older people with mild B12 deficiency tested oral cyanocobalamin doses from 2.5 to 1,000 micrograms daily for 16 weeks. Higher doses produced greater reductions in methylmalonic acid, a blood marker that rises when cells do not have enough functional B12, and the investigators estimated that roughly 647 to 1,032 micrograms daily produced 80 to 90% of the maximum biochemical response. Another study of elderly patients with established food cobalamin malabsorption used up to 1,000 micrograms of oral B12 daily for at least 1 month and found that 85% normalized serum B12, while bone marrow regeneration was seen in all participants. Notice the timeline: 1 month, not 3 days. Treatment can begin working biologically before you feel fully restored, but nerves and anemia may take weeks or months to improve, and severe neurological symptoms need prompt medical attention. These research doses are not a personal prescription. Your dose and route depend on the cause, severity, laboratory results, medications, and whether absorption is impaired. The adult recommended dietary allowance for B12 is 2.4 micrograms per day, but older adults may benefit from obtaining some B12 from fortified foods or supplements because crystalline B12 does not need to be separated from food protein in the same way. Natural sources include fish, meat, poultry, eggs, and dairy, while fortified cereals and nutritional yeast can provide B12 for people who avoid animal foods. If deficiency is confirmed, a clinician may recommend a much higher oral dose or injections depending on the cause. The synergy tip is to fix the entire production line, not one nutrient in isolation. If your ferritin is low, iron must be addressed. If folate is low, folate matters. If kidney disease is reducing EPO, vitamins alone may not solve the problem. If there is bleeding, the source of bleeding must be found. Think of B12 as one essential key in a ring of keys. Owning the brightest key does not help if the locked door requires a different one. Let me tell you about Eleanor, a fictional composite patient who represents a pattern clinicians see often. Eleanor was 72 and lived in Tucson, Arizona. She had spent 3 months feeling weaker every morning. She needed both hands to rise from her dining chair, her feet tingled at night, and she occasionally felt dizzy when she stood. A neighbor told her it was her liver and advised beet juice every morning. She tried it for 2 weeks. When she finally had laboratory testing, the important clue was not liver failure. Her B12 was low, her red blood cells were enlarged, and further testing supported B12 deficiency. Her clinician treated the deficiency and reviewed her diet and medicines. Over the following weeks, her blood markers improved and her energy gradually returned. The tingling took longer. She also began a supervised strength program because correcting anemia did not automatically rebuild muscle loss through sarcopenia. Her story is not proof that everyone with weak legs needs B12. It proves the opposite. Symptoms can look similar while causes are different. Now consider Robert, another fictional composite, age 68, from Pittsburgh. He felt tired, short of breath on stairs, and noticed his heart pounding after small tasks. He assumed he needed more iron and started eating beetroot and taking an over-the-counter iron supplement. His doctor ordered a complete blood count and ferritin, confirmed iron deficiency anemia, and then asked the question that matters in an older adult. Why is the iron low? Further evaluation found slow gastrointestinal blood loss from a lesion that needed treatment. Once the bleeding source was managed and his iron was replaced under medical supervision, his hemoglobin rose over time and his stamina returned. Kiwi became a useful food alongside iron-containing meals, but kiwi was never the cure for the bleeding. That distinction can save a life. In men and postmenopausal women especially, new iron deficiency anemia deserves evaluation for blood loss rather than indefinite self-treatment. So what should the famous 3-day recovery really look like? Day 1 should not be a miracle recipe. Day 1 should be recognition. If you are over 60 and you have new weakness, dizziness, palpitations, breathlessness, pale skin, shaking, or difficulty standing, contact a healthcare professional and ask whether a complete blood count is appropriate. Depending on the situation, your clinician may check mean cell volume, ferritin, transferrin saturation, vitamin B12, folate, reticulocyte count, kidney function, liver enzymes, thyroid function, and other tests. Reticulocytes are young red blood cells. They tell us whether the bone marrow is responding. Day 2 can be about removing obvious nutritional obstacles while you wait for guidance. Eat regular balanced meals, include protein, include iron-containing foods, pair plant iron with vitamin C-rich produce such as kiwi, stay hydrated unless you have a fluid restriction, and avoid using concentrated supplements as a substitute for diagnosis. Day 3 is about acting on the cause, not chasing the symptom. If tests show B12 deficiency, treat B12 properly. If folate is low, correct folate while making sure B12 has been considered. If iron is low, find out why. If kidney disease is reducing EPO, the kidney problem matters. If liver disease is present, the type and severity of liver disease determine treatment. And what about the liver itself? At 60, 70, or 80, the liver can still respond to healthier conditions, but liver failure is not something beetroot, kiwi, folate, or B12 can reverse on command. Fatty liver related to metabolic disease can often improve when the underlying drivers improve. Alcohol-related liver injury requires stopping alcohol and medical assessment. Viral hepatitis requires appropriate testing and treatment. Medication-related injury requires professional review. Advanced cirrhosis, meaning extensive liver scarring, may not fully reverse, although treating the cause can prevent further damage and sometimes improve function. The National Institute of Diabetes and Digestive and Kidney Diseases notes that cirrhosis may begin with tiredness, weakness, poor appetite, weight loss, nausea, and muscle loss, while more advanced disease can cause swelling, easy bleeding, confusion, and internal bleeding. Those symptoms overlap with anemia, which is another reason not to diagnose yourself from a single symptom. There is also a muscle lesson here that many anemia videos ignore. After 60, strength loss is rarely caused by one nutrient alone. Sarcopenia, inactivity, inadequate protein, inflammation, nerve disease, medications, poor sleep, heart disease, lung disease, kidney disease, and anemia can stack on top of each other. Correcting a deficiency may restore the missing building material, but your body still needs a reason to rebuild. Once your clinician says it is safe, regular resistance exercise, adequate protein distributed through the day, enough calories, good sleep, and treatment of chronic disease help muscles respond. This is where anabolic resistance matters. Older muscle needs a stronger, more consistent signal from protein and activity to maintain tissue. Your mitochondria also benefit from movement. So if your hemoglobin improves, but you remain weak, do not assume treatment failed. Ask whether strength, balance, nutrition, heart function, medications, and neurological health also need attention. Remember the countdown. Beetroot is number 4 because its nitrates may support circulation, but evidence in older adults is mixed, and it does not treat the cause of anemia. Kiwi is number 3 because its vitamin C can improve absorption of iron from a meal, and a 16-week randomized trial showed better iron status improvement when gold kiwi was paired with iron-fortified cereal than when banana was used. Folate is number 2 because bone marrow needs it for DNA and rapidly dividing blood cells, but high-dose folic acid can be dangerous when B12 deficiency has not been excluded. Vitamin B12 is number 1 because deficiency becomes more common with age, may arise from poor absorption, and can affect both red blood cell formation and the nervous system. None of these 4 should be sold as a 3-day cure, and that is not disappointing news. It is empowering news, because once you stop chasing miracles, you can start targeting the real cause. Your goal is not simply to raise a number on a laboratory report. Your goal is to stand from a chair with confidence, walk across the room without fearing dizziness, climb steps without your heart feeling like it is racing against you, and keep doing the ordinary things that make life feel like your own. Independence is built from many small victories: the right diagnosis, the right nutrient when it is truly needed, enough food, enough movement, safer medication choices, and timely treatment of kidney, liver, heart, or digestive disease. Being 60, 70, or 80 does not make improvement meaningless, and it does not make weakness normal. Your body may recover more slowly than it did at 30, but older cells still respond when the correct problem is addressed. Give yourself evidence, not promises. Give your muscles training, not fear. Give your blood the nutrients it actually lacks, not whatever happens to be trending online. And give your liver professional care when it is truly sick. If this video helped you understand why anemia, weak legs, trembling, dizziness, and liver concerns must be separated instead of blended into one miracle claim, subscribe to the channel and share this with someone over 60 who keeps saying, "I am just getting old." Then tell me in the comments, which symptom would you want your doctor to investigate first? Weakness when standing, dizziness, a pounding heartbeat, numb or trembling hands, or unusual fatigue? I read every comment, and your answer may help shape the next video. Your strongest years do not have to be behind you, but the next step begins with finding the real reason your body is asking for help.